Manager for the Great Plains Breast and Cervical Cancer Early Detection Program. Previously, I was the program manager for our comprehensive cancer control grant that we had. And I also am trained in some chronic disease self-management programs. So currently, the Health Board has a chronic disease self-management program. Our Great Plains CDSMP offers self-management support programs to empower and prepare individuals to manage their health. We offer two different programs within our program. That is the Active Living Every Day, which is what I'm going to talk to you about today. We have two facilitators who are trained on staff. This means that these facilitators are able to provide the program to communities as well as train in new facilitators. And then besides Active Living Every Day, we also have the Better Choices, Better Health program, which we previously had Cole Hunter and Paula Brown share information on that. And currently we have 3 lay leaders, soon to be 4 lay leaders, and then 1 master trainer on staff here at the Health Board who are able to implement those programs. So I will start now talking about what is Active Living Every Day, and I'll also refer to it as ALED. So Active Living Every Day, as you are aware, many people have become more sedentary in their lifestyle, and a lot of occupations involve a lot less physical activity than they once did, and a lot of us don't actually engage in doing planned exercise or physical activity. So a result of having a sedentary lifestyle has led to what many are calling the current obesity epidemic. And obesity is just one of the visible signs of not partaking in physical activity, but there's also many more health problems associated with a sedentary lifestyle. This could be having issues with heart disease, cancer, getting diabetes, and also includes mental health problems. So Active Living Every Day is a program that is used to improve your health and well-being through physical activity. This program provides information, skills, and processes for creating active lifestyles for people who are participating in the program. And it's a proven behavior change program that's designed to help people adopt and maintain healthy habits. So in 2008, the U.S. Secretary of Health and Human Services released the physical activity guidelines for Americans, and this was an extensive research done. And what that release said was that adults needed to engage in at least 150 minutes of moderate to vigorous intensity physical activity each week. And what Active Living Every Day does is it uses different behavior changes and activities to allow individuals to incorporate physical activity into their lifestyle. And it helps people learn how to enjoy physical activity and how easy it is to add physical activity to their daily lives. Basically, it's based on each individual. So that individual would create their own activity plans based on their own preferences and however their lifestyle is, and then they're encouraged to choose activities that will fit easily into their daily lives. So what's important is that by making these small changes in their daily lives, they're actually making a very important lifelong change with a commitment to incorporate more physical activity into their life. I don't know, something just happened. Okay, I'm gonna keep going. So what is the Active Living Every Day philosophy? This is the main 3 points for the entire program. It's 3 principles that that Human Kinetics and the Cooper Institute, the founders of the program, have determined work in research. So the first principle is that moderate amounts and intensities of physical activity result in significant health benefits, especially for sedentary people. The second principle is that lifestyle physical activity is an important way for people to fit physical activity into their lives, whether that's through unstructured physical activity or more structured exercise. And I will touch on the difference between exercise, physical activity, and lifestyle physical activity in the next slide. So it can also serve as an important complement for people who already do structured exercise and just want to add more physical activity into their life. And finally, the third principle is that people are more likely to become and stay physically active when they're taught the appropriate lifestyle skills that are based on their own readiness to change. And this is where we bring in the fact that the program is tailored to each individual. So it's the preference of the individual who is doing it, where they're ready to change. Oops. So the structure of active living every day is that it starts at the organizational level. So what would happen is that an organization may decide to start promoting the Active Living Everyday program. And what they would do is that you would sign a license agreement or start getting trainers and staff members trained to facilitate this program. And that can be done on a variety of organizations. It can be done like it is here at the health board, just through one of our programs. It can be done through IHS, through the hospital. It can be done through tribal health. It can be done basically through any community program that is active and passionate about individuals becoming more active in their everyday. So once the organization has adopted that they're going to start using this program, they would get their training, the facilitators trained, and then Human Kinetics is the education center that would provide resources for you that you would need. And then after that, you would determine a course location for where you're going to actually hold the program. And what's important to note is that the courses for Active Living Every Day, there's no real set structure on how many sessions you hold. You can basically hold between 6 and 20 different sessions, just depending on how long you want the program to go on for. And so ideas for course location would be you could hold it at the community center, you could hold it, at a public health entity, a work site, in the hospital. A really good place that we found a lot of success is holding them at the elderly centers or at senior centers. It's an easy spot for individuals to come and participate at. Another thing to note about ALED is that it's a flexible delivery system. So this means that you don't have to follow the same structure week to week. So if you want to do it in a classroom setting one week and the next week you want to do something online instead, you can do that. It's completely, you're able to tailor it however you want. You can use it, and we found that using a combination or doing an online based is very successful. As for class format, that would be group sessions so that you can foster group support among your participants. And also, you would be doing in-class activities and then at-home activities as well to reinforce the material that they learn during the in-class, technically. And then curriculum. This is, so ALED, like I said before, uses a few different ways to teach and present material. This is done through goal setting, identifying and overcoming barriers. There's a very large push for teaching self-monitoring for the group, and also creating a social support for group members to really lean on each other and learn from each other on what's working and how they can incorporate physical activity into their life. Again, this curriculum is done on an individual basis. So it's however the readiness to change that individual is. So one person in your group may be at the point where they're ready to incorporate more physical activity, and another person might just be thinking about it. You know, they know the side effects of living a sedentary lifestyle, but they're not exactly sure how to go about incorporating physical activity or what that even means. And that's where the ALED program comes in. It will teach participants the benefits of incorporating physical activity. Okay. So I'm just going to touch briefly on the difference between lifestyle physical activity, and exercise. So these are three they're very similar but also very different. So what ALED is seeking to do is promote lifestyle physical activity, because that is different physical activity incorporated into the participant's everyday life. This can be done through goal setting, self-monitoring, and using social support. So an example of lifestyle physical activity would be somebody choosing to work in the garden or play with your kids at the park, or if you're at work and you're on a break, you decide to go for a walk on your break. And then if you're able to do those things, you reward yourself. So the key to lifestyle physical activity is that it's just incorporated into your everyday life. So again, this could even be at your work a little further away and just walking a little bit extra that day. So physical activity is just any bodily movement that will produce an expenditure of energy. And then exercise is when it's planned, structured, and repetitive, and it's done to improve or maintain one or more components of fitness. And exercise is often, we think of things like cardio by running or doing like aerobic exercises. And another thing just to note is that a lot of people don't like the word exercise. If you talk about that, many people can be put off by that. So instead, that's why we use things like lifestyle physical activity, because if someone's going to tell me I need to go and lift weights at the gym, I'm going to be a little more turned off to that idea versus saying like, hey, you could wash your car once a week, and you're getting more physical. Okay. So again, the main goal of the lifestyle or physical activity of ALED is that we want participants to have 150 minutes of moderate intensity physical activity in a week. So they define moderate intensity as basically a brisk walk, how you would feel if you were having a brisk walk. Or you could incorporate 75 minutes of vigorous intensity physical activity. Again, this is done on a case-by-case basis, and it's dependent on where the participant is in their own preference and what their lifestyle currently is. So again, the case for physical activity. So we know that physical activity, inactivity, leads to decreased health and fitness among participants. There's a significant economic cost to our society. This can include decreased productivity, an increased absenteeism, higher healthcare costs, just due to all of the different health-related issues you can have from being physically inactive, and more workplace injuries. So there's been a growing amount of research that has proven that short bouts of moderate intensity physical activity can provide significant health benefits, which is why we really push for moderate intensity. This is not a workout program. This is just introducing physical activity into people's lives and however they want that to be. So again, 2-minute walks, if that's all you can do, that's okay. That's still getting the physical activity, and that's still going to lead to health benefits in the long run. Let's see. So another thing with ALED is just kind of promoting a certain physical activity guideline for older adults. And this is that if you can't do 150 minutes of moderate intensity, that's okay. Just as long as you can try to start incorporating that physical activity in, that's really what the program is about. It's again, tailored to every person. It's their own preference. For older adults, it's really important too to kind of promote exercises or activities that would improve their balance if they're at a risk of falling. And also to determine the level of effort for physical activity relative to their level of fitness. That's, you know, for example, I don't work out and do those things, so I'm not going to say, I'm going to go run 10 miles. That's my goal, because that's unrealistic. I'm going to start small and start incorporating small bouts of physical activity into my life before I make a large goal like that. And another important thing for our older adults is that people with chronic conditions should understand how their conditions will affect their ability to do activity. So this is a picture of the Active Living Everyday book, which is what, if you were to do a program, each participant would receive the book and access to online resources as well. But so Active Living Every Day, again, is the research backs it up. It's proven to work. Some results that you can expect from if you are to do the program: more energy, brighter mental outlook, reduced risk of heart disease, high blood pressure, stroke, and diabetes, less chance of getting a cold or flu, better weight control, maintained fitness and flexibility, and then a reduced risk of depression. So again, I'm just going to go over these. I've listed them like 1 through 12, I think. These are just basically how you would, how do I want to say this? How if the facilitator is doing a program, these are things as a facilitator that you will cover with your participants. So if you're doing Active Living Every Day, you are going to start understanding how to incorporate lifestyle changes, how you're spending your time. They do a lot of journaling, a lot of goal setting, doing rewards, and then they're going to go over ways for that individual on how you can add different activities that are relative to you into your life. So as a participant, you'd be able to find more opportunities to be active, know the benefits of incorporating activity, and then creating activity plans. Another thing, you would be able to recognize the challenges that you're facing in your everyday life. Again, review benefits of physical activity, and then also they will teach you how to use problem-solving skills to get past the challenges you may face in your own life and why you're not able to incorporate physical activity. You will learn how to set goals, identify rewards to help you stay motivated, and then create positive messages to encourage yourself. You will learn how to determine energy expenditure of physical activity. Again, this is this program relies a lot also on social support. So being able to turn to friends and family for encouragement and support of incorporating more physical activity into your life. They will touch briefly on stretching and muscle strengthening if the individual who's participating is at a point in their life where they are able to incorporate more structured exercise. Also, the participant would be able to identify areas where they may have setbacks and learn how to deal with those setbacks and plan around them. So if you know that you have, something coming up at work and you're not going to be able to do a bunch of activities, it would be a way you would learn how to get around that. So you might be busy at work, but you're still able to go on your 15-minute break and go on a walk. Lines. They will also teach you how to use step counters, logging physical activity, and then also just always going back to what your original goals are. And if that means tailoring them, if you've really added a lot more physical activity, you can tailor your goals and rewards. Excuse me. And finally, the participant will be able to celebrate their accomplishments and then discover ways to renew motivation to remain active, and then also just troubleshoot and learn the different risks you might have or setbacks and how to get around that. So at this time, I would like to introduce Chad. He is our new Great Plains Chronic Disease Self-Management Program Coordinator. So I will have him just come and introduce himself and give you a brief background.
Hi guys, like she said, my name's Chad Radigan. New here to the program, really excited about it, just learning about it now, and I'm looking forward to going through the training and working with everybody. So thank you guys, and I look forward to working with all of you guys.
All right, and we will be sure to send out Chad's contact information, as he will be the one that's going to be kind of taking over next steps and what that means. So next steps for our program here at the Health Board, Chad and I will be working together on setting up a facilitator training. That is likely going to be held in the Rapid City area, but again, location and time to be determined. So that would be for individuals seeking to get trained so that they can implement the Active Living Everyday program in their communities. Another thing that we're going to be working on is that we are going to host an Active Living Everyday webinar series, which would be for people who want to participate in the program. Anybody who's really looking to adopt a healthy lifestyle is eligible to take part in our webinar. And again, the date of when that's going to start has not been determined yet. So as soon as we know, we will be sure to send out the information that we have. And that's it for Active Living Every Day. Does anybody have any questions? Okay.
All right. Well, thank you, Kendra, for that presentation. Just a reminder, this presentation has been recorded, and I will be sending it out to everyone, also along with Kendra and Chad's information. So if you do have questions later on, you can contact them and ask them questions about the program. Also, our next webinar is going to be her name's Sonia Shin, and she works with the COPE program, and she's going to be talking about their fruit and veggie prescription program. It's a really cool program, so you won't want to miss that one. We will be sending out a calendar invite soon, so you can put that on your calendars. That will be on November 8th at 1 p.m. Mountain Standard Time. Looks like you have a question, Kendra. Is the ALED training a train the trainer?
Sure. So there's two portions of Active Living Every Day. We are able to train the trainer, but we are also able to implement this program in communities for individuals who just want to adopt a lifestyle. So we have kind of the Active Living Everyday program, which is what I was talking about, but we are able to train the trainer, yes. And that's what we currently have in the works, is to do one of those and then to implement a webinar series for the Active Living Everyday program.
All right. Well, thank you, Kendra and Chad. Don't forget there is an evaluation link in the chat box. If you can click on that and fill out the evaluation before exiting the webinar, that would be greatly appreciated. Otherwise, thank you for joining, everyone, and we'll see you next month.
Thank you.
Thank you.